The brain in your gut is also known as the enteric nervous system. It's a collection of nerve cells, or neurons as we call them, that are actually within the wall of your entire gut, starting from the esophagus all the way down to the rectum. This brain or nervous system is quite independent of the other brain, the one inside our head. In other words, it can function on its own in what we call an autonomous fashion, and is very important for regulating the function of the gut, those functions being absorption, digestion, and moving material from one end of the gut to the other. The gut is a sort of a colloquial term that we use for the gastrointestinal system. The gut really is the engine that transforms energy in the environment to energy that's in a form that we can use. And without that function, life would not exist. What's also not commonly known is that it has more nerve cells than your entire spinal cord. And what's also not commonly known is that 90% or more of the body's serotonin actually lies in the gut, not in your head. And about half of the body's dopamine lies in the gut. And this is actually now the subject of studies trying to link what's happening in the gut with what's happening in our head. There are many conditions that are caused by problems with this brain in your gut. These conditions are surprisingly common. Let me give you some examples. Irritable bowel syndrome, for instance, or IBS. Other examples include common conditions such as gastroesophageal reflux disease, acid reflux, or heartburn. Some general symptoms for disorders of the enteric nervous system or this gut brain include nausea, unexplained abdominal pain, change in bowel habits. As far as risk factors for these disorders are concerned, we don't know a lot. The enteric nervous system in women appears to be more vulnerable to these changes than that of males. Part of it is maybe related to hormonal changes, but part of it may also be related to how the nervous system develops in females. A third component is perhaps social in nature. Women may be more likely to seek health care than male counterparts for these disorders. The treatment for these conditions is difficult. It's an area that has not received a lot of attention, both by scientists, physicians, and then of course by the lay public. In our laboratory, we are studying all aspects of this enteric nervous system. We are also looking at using the brain in the gut as a surrogate for changes in the big brain. We're taking biopsies from the gut and examining the nerves in those biopsies in patients with Parkinson's and trying to see if we can identify changes in the neurons in the gut that would indicate similar changes in the brain. And finally, and very, very exciting aspect of our research is that we are able to identify neural stem cells from gut biopsies. And these neural stem cells theoretically have the capability of developing into all kinds of neurons, not just those within the gut, but potentially in the big brain. So they may serve as a very convenient and readily accessible source of neural stem cells from the patient's own body.